On behalf of Chennai chapter, I welcome you all. It's nice to see so many participants from all different chapters, and it is very good that you people have taken time and arranged to be here. So with that welcoming, I want to inform all of you, as the doctor is doing her presentation, whatever doubt you have, questions you want, you please post it in the chat. I hope by now all of you are aware of how to post in the chat, because I'm seeing already so many people have posted, and they are all regular, so they are aware of it. I would like people to put a Y in the chat and enter it addressed to everyone. So let me see how many of you are able to post it. People who have already posted, I know they are familiar. All of you, if some of you start putting yes or Y in the chat and select everyone, so that the question will be yes. Now I am saying Vishwanath Rao, Rajappan, of course, Yamuna, they are all familiar with this exercise. They know. Rastogi, yes. Right. Now, I am sure that many of you are aware of how to post your question in the chat. Now, with this welcoming address, I will close it, and then I invite Yamuna, one of our senior members in Chennai chapter, to give the introduction about the doctor, our guest today. Yamuna?
Okay.
Please.
Yeah. I really take this as an honor given to me to introduce a very famous and name in her field, Dr. K. Reena Rao. And she's going to talk about lifestyle disorders. You know, our lifestyle has changed a lot. We have all grown with global thinking, and at what cost? All these questions will be answered by Dr. Reena Rao to every one of your questions. But in the meanwhile, I would like to just give a glimpse of her qualifications. It is so much that I'm just taking only the gist. Dr. Reena Rao is a MBBS, PG in diabetology, F diabetology, and then she is a consultant physician for so many diabetology concerned hospitals. Especially she's heading the Germaltus Hospital, and she has got a decade of experience in this field. And she has been regularly conducting camps and awareness programs for everyone, especially to children on juvenile diabetes, and equally for adults and women in special. So over to Dr. Reena Rao.
So good evening, everybody. Thank you, Yamuna Madam, for the kind introduction. So as requested by the foundation, they have asked the talk to be in English as well as in Hindi. I don't know whether Chennai people will be happy. I hope Chennai people are more specialized in English also. So it will be a multilingual language. So we can go ahead with the talk. So I would like to share my slides. I just want to see if it's moving ahead also. Is my first slide visible?
Yeah.
Okay,
Yes,
thank
sir.
you very much. Okay, as sir has mentioned, Kasi sir, if you have any doubts, you can just put it down in the chat box. We can discuss in detail in the end of the session. So we'll be viewing about a lifestyle disorders in depth. So what we are going to see is only the top view, that is only the tip of the iceberg. So what is hidden below, we look into it one by one. What are the causes of lifestyle disorders? I know I'm a diabetologist, but I feel what are the causes of diabetes, what are the fields related to it is also very important to know. So let's go one by one. So as we all know that these are all the um, some of the lifestyle disorders that we know, that is diabetes, hypertension, cancer, and obesity. Let's look into the root cause of it. So this is one of the picture which I actually uh, zoomed it, and I have done an editing work. So if you look again, we are going to look into the pre only. That is what it means: high blood pressure. We have depression, we have diabetes, we have um, uh, and cancer, allergy related. So what is the root cause? If you look again, it's because of stress, poor lifestyle. That is, it includes poor diet, lack of exercises, and we have another cause is genetic. So genetic we cannot change, but at least we can prevent from getting those, postpone the disease from occurring in us in the later session. So let's discuss one by one in the following slides. So this will be how it goes on for today. So let's face the multifaceted issue. So definitely alarming situation, lifestyle disorder is not only globally, but also as in Asians, being the ethnicity of being obese and other things we'll be discussing. So how are we going to address the lifestyle stress? So detect, protect, and prevent the strategy. So if you see the detect means we are going to, how we're going to detect the symptoms and how we're going to protect them from the risk factors and how we're going to prevent the complications. So who are the target groups? So that in much detail I will be focusing on. And the preventive aspects, that is the how we're going to do the lifestyle modification, which is going to be for a lifetime, not only for a very short duration and just leave it off. So this is just a cartoonic presentation of what is a lifestyle disease. So health problems that react to changes in lifestyle and the disease that are caused partly by unhealthy behavior and partly by other factors. So let's see what are the factors involved. So if you look at the causes of lifestyle diseases, so certain habits, behaviors, and practices such as poor eating habits, inactivity, smoking. So these are all the controllable factors which can be reverted. It's up to us. It's all there in our hands. But there are factors which we cannot control. One is our age, gender, and hereditary. So these are all uncontrollable factors. We keep aging. We cannot change our genetic pattern. That is, that if our parents are diabetic, definitely the genes will be transferred. But how we can prevent this and postpone the occurrence of lifestyle disorder is by reducing stress and having a better lifestyle than being a sedentary habits. And most important, I notice it nowadays, younger generation people, they have odd working hours and they eat untimely. So all these things are all some of the causes. So one by one, we look into the lifestyle disorders, and then I'll just curb myself to diabetes and how are the complications occurring because of diabetes. So this is the WHO list of common lifestyle disorders. You see the top 4 list. One is the cardiovascular diseases. Then we have diabetes. Then we have COPD, that is for the lung issues, and we have cancer. And asthma, other things are all, some are genetic, some can be because of the status where they work. Some we say, like it's called the industrial pollution is that because of that people can end up having asthma. And due to the irregular lifestyle habits and food habits, a lot of people have peptic ulcers. The very young age, so like 20 plus, so they all have a end up having acidity problem. So that is also called GERD, that is gastroesophageal reflux disease. And genital urinary conditions. You will be really wondering why genital urinary, because of long working hours and nowadays people who work from home, they have continuous meetings. So they do not use the washrooms also. So that's one of the reasons why we normally see UTI, not only in females, but also in a lot of cases of males landing up having urinary tract infections. And last but not the least is like neuropsychiatric disorders like depression, anxiety, and stress. So according to WHO facts and figures, lifestyle related diseases are now the most leading cause of death worldwide. And if you see the mortality, it's around 36 million people are dying because of lifestyle disorders. So again, what we have seen again is a tip only. So let's see what's hidden. So normally, अगर हम देखेंगे तो only we think is that ज़्यादा से ज़्यादा हमारे urban, like is like what is we are staying there only, there are more of hypertension and diabetes and cardiovascular disease. But what happens is it's also found in even in the rural areas equally. A lot of people from the rural areas also are affected. So that this is one of the paper clipping which I wanted to share with you.
Dr. Reena,
Yeah.
sorry to interrupt you.
Yes, sir.
There is somebody who wants you to go a little slow.
Slow. Okay,
You
okay.
seem to be fast. So
Okay, okay.
thank
No
you.
issues, no issues, no issues. Okay, so that what I was saying was like we normally feel that hypertension, diabetes, cardiovascular are more common in the city life. But nowadays, if you see the stats, it's almost like coming up to equal. They almost like having the same lifestyle what we are having even in the rural areas. This is one of the clipping which I found interesting and I wanted to share with you people. So yeah, today's health reality, if you see, living a life you love begins with a great health. But today's unfortunate reality is that many people lives are plagued by leading causes of premature death. The majority of these degenerative diseases are caused by poor lifestyle choices, but it's never too late to make a change for the better. So what if you see here is, if you see, it's the cardiovascular disease, it's around 17.3 million. And if you see diabetes 1.2, what I wanted to say here is people do not die only with diabetes. So because of diabetes, they have a lot of cardiovascular disease accompanied by it, or diabetes is one of the major cause for having cardiovascular disease, stroke, as well as respiratory diseases. So regarding this, I will be talking in much more detail. So metabolic syndrome, what I mean the metabolic syndrome, like I said you, the constellation interrelated. If you have more than 2 symptoms of this, you are termed as metabolic syndrome. So maybe a person is having diabetes and having hypertension. So again, it's like 2 symptoms together, 2 disorders together, they come under the category of metabolic syndrome. This might be a little bit technical, like medical technology. So I will just skip this slide. But what I wanted to say was this all these things clusters put together, it's called metabolic syndrome in medical term. Yes. So if you look at the global situation versus the Asians, around 1/3 of adults worldwide have metabolic syndrome. So people with metabolic syndrome are 3 times more likely to have myocardial infarction, that is heart attack or stroke, and 5 times greater risk of developing diabetes. So you might be thinking like Asians are quite lean, they might not be having much of that, but they are called as metabolically obese with normal weight. So if you see their weight, it might be normal, but everywhere, if you look into their BMI status, or if you look do a scan, we can find out the fatty liver. So that's why we call them metabolically obese. So up to 80% increase in mortality and morbidity is purely due to metabolic syndrome related to cardiovascular and diabetes. So this is what is the graphical presentation of the prevalence of metabolic syndrome in the Asian Indians compared to the whites. So although the BMI of the whites are more, we are more metabolically obese than them. So because of our diet pattern. So regarding that, I will again be touching about the diet and everything in much more details in the coming slides. So what are we going to aim at? So how are we going to detect, protect, and prevent? So detecting the signs and symptoms is very, very important. With appropriate investigation is one of the key words. Next is to protect from the modifiable risk factors. As I have mentioned, the risk factors like smoking, alcoholism, like sedentary lifestyle. So these can be the reversible risk factors. And how are we going to prevent? So now they've already got the disorder. So how can we prevent them from the complications? So that these are the 3 main keywords that we are going to look into it. So detecting the marker signs. So what I wanted to see here and note is these are all the small skin tags, and this is called the acanthosis nigricans. These are all dark patches which are mostly found in the nape of the neck, in the armpit, as well as in the groin areas. So people keep thinking that it's some sort of dirt, or it's maybe because of the long application of artificial jewelry or chain rubbing the skin, but it's not so. It's called insulin resistance. That's why they land up having acanthosis nigricans. So they go to a skin specialist and they keep telling, and for cosmetic purpose, they keep telling that these marks we normally see. So can you please do some laser treatment or creams? So unfortunately, those creams, laser treatment, whatever they are spending, is going to go waste, because these are basically because of insulin resistance. Your body insulin secretion is coming down. So that's when you land up having diabetes. And these are also the marker sign for a pre-diabetic. So when people have this, they have to be sure and check their sugars at least once to make sure whether they are in the pre-diabetic stage. Pre-diabetes is nothing but it's the condition in between normal and the diabetic status. So these are the target group. But I said when I talked about target group, these people can actually revert back to normal. So these, when you find any symptoms or signs of these skin tags in your neck, so please come and check yourself to find out whether you are in the pre-diabetes stage. Next, I put this picture because nowadays we never say that when a child is born, it's a more chubby child. So we want a healthy child, not a chubby child. So inculcating good habits or food habits should start from the childhood. And this again is a cartoonic picture which I put was most of our Indians, especially in the rural areas, they are quite slim, but they have the spot belly. So invariably, so where is the fat? The fat is there in the liver, abdomen, all hidden fat. So that's why they are called metabolically obese. Okay. So regarding the symptoms of metabolic syndrome, I will be discussing in much more detail because this picture is little small for people to go through it. So as said, the modifiable factors and unmodifiable factors, unhealthy diet, lack of exercise, stress, obesity, diabetes, smoking. So these are all we can actually keep it under control. It's there in our hands. So and one more thing which I normally noticed was vitamin D deficiency. So that is already always related with type 2 diabetes. The studies which says that people who are having type 2 diabetes end up having a lot of joint problems. So invariably when we check their vitamin D, it showed very less. In fact, it showed a very lot of deficiencies were there that people end up having even fractures also. So not only calcium we have to give vitamin D also for patients who are landing up having joint problems with diabetes. Next is GDM. I will talk about this in much more detail. GDM is nothing but gestational diabetes. That is patients who land up having diabetes during pregnancy. And there are other factors which land up having diabetes is like drugs induced. Now recently because of the pandemic, because of corona positive patients, we had a lot of patients who were on steroids. So what happened was unfortunately patients who were on a high dose of steroids and dexamethasone were becoming diabetic, but later on a very good treatment, then we had to revert them back. So that is only for a short duration. So again, never neglect a PCOS. PCOS is nothing but it's very common in ladies who are having a polycystic ovary disease. That is, a lot of cysts are there in their ovaries, which lands up them to have obesity, and they have a lot of facial hair, and their periods are not regular. So that is a different issue. And pre-diabetes and childhood diabetes. So one thing is genetic predisposition. If you see, if both parents are obese, then 80% risk that children will be obese in the near future, landing up having lifestyle disorders. This again one of the journal which I picked up this pictures. So know your numbers. So basically, once you go for a just health checkup, you should just have this basic knowledge of what is knowing your numbers, which is the right thing for you. So if you take your blood sugar, it should be less than 130 by 85. So that is the right thing. You can just check your waistline. So if you're a female, if it's your 35 inches, then you're very good under control. For a male, 40 inches is fine. If you're plus 35 and plus 40, then slightly metabolic syndrome, you're going to land up in having the lifestyle disorders. So you're at risk. And just do a fasting sugars and just check. If your sugars are within control, it is 100, then you're going to be normal. If you're 100 plus, then you're starting stage of pre-diabetic. Then if you're 125 plus, then you're going to land up having full-blown diabetic. So these are all the checks that you can do at home itself with a glucometer and with a blood pressure mission. Yeah. Other things are the cholesterol, which we need to do a blood workup to find out whether you're having triglycerides. That is especially people who are having high stress levels. Young people have seen landing up having triglycerides more than 500, 600, but they happily walk into the hospital or clinic with no particular symptoms. But what happening inside is the blood vessels gets clogged. That's when we have a lot of young patients landing up having heart attack in a very young age. So metabolic syndrome, we normally think that it affects only elderly people who are 60 years plus. So I will say a big no here, because most of the people nowadays we see starting from the age of 20 plus will end up having metabolic syndrome, full and full, basically because of the lifestyle habits that they have followed. That was actually animation slide. I think it's not coming. Okay, anyway, no problem. So why are we talking fully about lifestyle disorders? So prevention is simpler, easier, cheaper than cure. So as we see, type 2 diabetes, we are in the second rank. I actually we should not be very proud of being in this as a second rank, because India is highly diabetic population we have, and we do not have much resources, especially in the rural areas. So let's see about it one by one. So diabetes definitely on a rise. So this commonly everybody asks me is, can the reversal of progression possible? The answer is yes as well as no. Why? I will let you know again in the next slide which is coming up. Who are the target groups as discussed? I'll just focus a little bit on it. And the levels of prevention is very, very important. And little bit to break the stereotypic talk what I'm giving now. We'll be talking about breaking the myths. Like normally they ask, if we eat too much of sugars, we will end up having diabetes. All these things are small things. We will discuss that also. So lifestyle modification, how are we going to do it? And empowerment. Why should a person know about this? Why are we having this awareness talk? That is what this all about. We are going to discuss in the next slide. So as we know, people around the world, is around 382 million people are having diabetes. But more than this, the alarming thing is that 46% are still undiagnosed. So maybe they are busy in their hectic schedule, or they do not want to go and check because they feel they are fine. So this is really very alarming. So this is the right time. Once we check and we find out whether they are diabetic or just starting stage, we can actually revert them back and prevent them from getting diabetes in the near future. So these are all little scary numbers. I will just tell one or two. I don't want to just so 1 in 12% in the world land up having diabetes, and it's almost like if you look into that, every second people are losing their limb because of diabetes, called diabetic neuropathy related, and it's a risk factor. So that I will be talking about. So now by 2021, it's around 422 million adults have diabetes. The number is still on a rise. And 1.5 million deaths are caused by diabetes, not only diabetes alone, the associated comorbidity condition. A little bit, I thought I will go into the history of diabetes. So our Indian scientists, Sushruta and Charaka, they were the first person to find out about type 1 and type 2 in 400 and 500 AD. They found out that type 1 is very common in children, and type 2, they are not insulin dependent, but type 1, they are insulin dependent. So this actually taken from the textbook, but I will just tell what is needed. So diabetes is a metabolic vascular disorder. So that is because of chronic hyperglycemia. That is, you have high sugars in your body. So that is can be because of the defect in the insulin secretion. So there is insulin secretion there in your body, whether there is some defect in that or it's secreting very less. So these are the two reasons why we end up having diabetes. And this basically affects the microangiopathy. That is, it affects the small blood vessels as well as the larger blood vessels. That is, small blood vessels are the eye, the foot vessels, and larger blood vessels are the heart and the brain, which supplies this are affected. So this is actually a slide from Jocelyn Diabetes Center. So when I did my fellowship, I have the copyright for this to share with during my awareness talk. So a person without diabetes, we normally use it for empowerment for patients to understand what diabetes means and how it works up. So this red side is the blood vessel and this is the cell. So this person who's standing here like a policeman is the insulin secretion. So normally what happens, the glucose from the blood vessels has to go to the cell, that is a muscle, it has to work up, and then we burn out the calories. So if there is good insulin secretion, there is the proper way, a channel of going to the cell. But what happens in type 1 is that person is missing here. That is the insulin itself is defective. So that's when a lot of glucose lands up in the bloodstream, give them high blood sugars when we check it. In type 2, what happens is we have insulin secretion, but its secretory defect is there, and there is not much insulin secretion from the body. So that's why there's a struggle here. So once we give tablets or we give a short dose of insulin, then this will be rectified. So the types of diabetes, I think most of you will be aware. So I will just be just brushing up. So type 1 is most common in children. It's actually we really don't know the cause why it is, but they found out that it's immune mediated and there are some HLA genes involved in it when we did some studies. And type 2, as I mentioned, is more common in adults because of the insulin deficiency or the secretory defect. And gestational diabetes is diabetes during pregnancy. So it's like mostly 90% of the gestation diabetes ladies become normal once they deliver. And there are 10% of the ladies who land up having diabetes in near future if they do not follow good diet and exercise pattern in the future. There are other types. Some are like moody. I'm not talking about Dr. Narendra Modi. I'm talking about maturity onset of diabetes of the young, which is common in young children. But these people do not require insulin. They work very well with tablets. So to find out whether the child is type 1 or Modi, we normally do a genetic testing and then find out. So this is a very small group of children land up having Modi because we have done a lot of studies. I wanted to share with you people. And some are endocrine related. Some are related to other hormonal disturbances in the body. And of course, the patient is having pancreatic disorders due to alcoholism, chronic alcoholism, or they're having any fibrocalculous pancreatic disease. So this also, what happens is pancreas is the organ which secretes insulin. So when they're having pancreatitis, so there is a beta cells in the pancreas which decreases and prevents them from secreting insulin. So that's when they land up having diabetes. And LADA is the latent onset diabetes of the adults in a very late age. Normally, patients say that I got diabetes in only 65, 70 years. So that time, they are almost all the beta cells have gone. So the reserves of the insulin is depleted. So they are insulin dependent at this point. You cannot give them tablets. And some are drug induced, as I mentioned about steroids. Then there are some infections. So basically, working in Grimaltis Hospital, there are a lot of skin related issues which cannot be treated only with creams or tablets given by a dermatologist. The hidden factor is the diabetes, which is underlined. So we need to treat the patient as a whole. It's not that only treating the sugars. We need to treat as well as the infection accordingly. So if you look at the preventive aspects, so type 1, around 10% of the population only have type 1. So definitely there is no reversal in this progress because once you are type 1, you live with type 1 diabetes throughout your life, but you can have a normal lifestyle. You can, normally people tell, can I go and get married? I have a lot of patients who are type 1 who are married and who have children who are not diabetic. So it again depends on how you take up your lifestyle. 90% of other population is type 2. So this can be prevented. So that my answer was whether diabetes can be prevented is both yes and no. And gestational diabetes, of course, it's because of the stress levels in the body, ladies will end up having diabetes. But again, this can be reverted back once their child is delivered. So again, we are going to back to the detect, protect, and prevent. So how are we going to find whether the patient is having diabetes? These are all the major symptoms that we look in for it. Either it can be polyuria, that is using the washrooms, like they have too much of frequency of urination. Polydipsia means they feel very hungry. They would have eaten just half an hour before, again they feel very hungry. So that's a medical term called polydipsia. Or polyphagia. They keep drinking a lot of water. So why these three symptoms come, I will talk about that a little later. And fatigue. So again, there are a lot of other things related to fatigue. Fatigue is not that if anybody feeling tired, there are other things like anemia, or they can be having vitamin D deficiencies also. So, but we need to look into the other underlying causes also before terming anybody like fatigue is a very generalized word that we normally use. So we cannot just justify by telling that, okay, anybody is tired, they can be having diabetes. Yes, what you are looking into is a right path, but we need to justify it by doing a blood checkup. Fluctuation in weight. Normally we see that, okay, people will be quite healthy, but later they start losing a lot of weight. It's because all their sugars just gets washed out in the urine. So that's when they start losing a lot of weight. Numbness in the foot. So this is one of the things which we normally say, that is they come out telling that there is little numbness in the foot. So this is called diabetic neuropathy. So once patient complains of this, they've already started having the complications called neuropathy. Delayed wound healing. So it might be a small cut which is not healing after even 7 days also it's not healing. Then we need to look into it. And of course, blurred vision, which affects the retina. It's not only the spectacles which is shown in this picture. There is something called retina which affects during diabetes. So all these things are the major symptoms, but unfortunately, what I'm 60% do not have any symptoms. They just flare up and come with 300, 400 sugars, which is really, really unfortunate. So yeah, this I said, like we normally look into this first when the patient comes with any symptoms of these. These are again the insulin resistance, that is acanthosis nigricans. And then we'll ask them to do the IDRS risk score, Indian Diabetic Risk Score, that we actually we found out how we can do it at home itself. Like I said, how we can just take your waistline and just calculate your risk factors. I will show it in the next slide. We normally do OGTT. If the patient comes, we give them glucose test and then see whether they are diabetic, or if they're not prepared to go for a glucose test, they can just do a fasting and postprandial, or the HbA1c test, which is a 3 months average of your blood sugar. So these are the tests which tells us whether you're a diabetic or you're in the pre-diabetic status. So this is what I was talking about, the Indian Diabetic Risk Score. So you can just take a clip shot of this in your mobile or in your laptop, whichever you're using. So this is actually very important. You can just calculate by yourself whether you are 35 years or 35 to 49 or 50 years plus. So your score again starts 30, and your waist circumference, as I said, you can just calculate it, and then you can again add up whether you're 10 or 20. And your physical activity. See, physical activity doesn't mean that you go hit the gym and go for 1 hour on the treadmill and come. Physical activity is like you go to the nearby market, you actually use your walk down to it, or you use your staircase for the going just 2-3 floors. So that those things are called physical activity, and it's different from exercise. So that again you can calculate by yourself. And family history. If your parents, any one of your mother or your fathers are diabetic, then the score is 10. If both of them are 20. So once you total up the score, if your score is landing up more than 60, then definitely you're at a high risk of having diabetes in your future. So I think I want most of you to calculate and let me know in the end of session, because it's very important. If you calculate and see, you yourself will be having a small awareness that where can I get corrected, whether it's my physical activity exercise I should improve, or whether I should reduce my weight. All these things you'll have a clear vision on it. Yeah, of course we cannot change our age, but of course physical activity and reducing our weight little bit can definitely help us. So this is just I'll just brush it up. It's American Diabetes Association's guidelines for blood glucose. So this is with the glucose, we normally do it. And if you just want to go for a random checkup, you can do a HbA1c level also. So this is what I want to touch up here. It's a pre-diabetic status. So just do a fasting, just go to the lab, just take your sugar. If your fasting is within the range of 100 to 125, then you're in the pre-diabetic status. Even one more than 125 is you are a diabetic. You must accept it and start taking treatment. So you might be like only 126. No, okay, let me start doing exercise and all. So that we should decide on how your lifestyle is going to be in the coming days. Not only based on your diet, also your exercise also makes a very important role in it. Next is the glucose tolerance, as I said. This is like little cumbersome, but anyway, if you can do it, you can. It's like 140 to 190. That is the 2 hours values. We find out whether there is even 200. If you reach, you are in the diabetic status. But if you're 140 to 199, you come to a notice that you are in the pre-diabetes. This I feel is very, very important for you to understand. So the target group again is a pre-diabetic state. So if your sugar levels is higher than normal, but not higher enough to be classified as diabetes, then that's what this is the place where you land up is pre-diabetes. So our aim is to pull this pre-diabetes towards normal. So 1 in that 3% have pre-diabetes, but they do not, as I said, they always say, I'm feeling fine. They do not willingly go themselves and check whether their sugars are normal or not. That's when they'll end up having all these problems. Yeah, this is one interesting thing which I found last month in the paper. It's not only the adults, we are very much worried about the children, because during the pandemic for past 2 years, all are having online classes. What they found was what? 5 to 9 years and 10 to 19 years of children are having pre-diabetes status. So this is really alarming. See, earlier I was little scared. Okay, we were very calm. When I started my career, it was only 50 plus people who were having diabetic. Now almost like 13 years of experience I'm having. I see now very young people like 20 plus now landing up having diabetes, especially the IT company people. They'll end up having diabetes, and all of most of them are obese. So now I'm again worried is because of the children who are landing up having diabetes in a very young age. So these are some of the complications of diabetes. So basically, it first affects the heart. Then you have peripheral neuropathy. That is, once you start having the numbness in the foot, so you will not feel anything. If anything pricks you also, that's when the patients land up having foot ulcers and gangrenous toes, and you have to amputate them. And retinopathy, as I mentioned, we need to go for an eye checkup to see if you're having any blurred vision, any retinal hemorrhages are there. And nephropathy, there may be a lot of kidney issues, but diabetic nephropathy is one of the major cause for mortality, one of the major cause for death. And neuropathy, again, I said, it might be a small ulcer which might be neglected because they are not aware. That's why I always say to my patient, like how you take care of your face, you should also take care of your foot in the same sense if you're a diabetic. So again, we are going back to the same question. Can the process of reversing of natural history of diabetes can be done? So yes, if you are in this state, that is the impaired fasting glucose or IGT, that is if you are in the pre-diabetes status, we can definitely pull you down to a normal glycemia. But by the time patient comes, they're always a full-blown diabetic. So when they go into this, we want to prevent the progression from having all these things. So they might be having mild neuropathy. Yes, we can control it. We can prevent from getting them from getting stroke. They're having mild retinopathy, again, blood sugar control. We prevent them from having blindness. So all these things are reversible once you are detected at the right time, at the right position, you should take it. So this is what I said, like primary prevention. If the patient is normal or in the pre-diabetic state, this is where we prevent them and protect them from the secondary causes. Once you are diabetic, okay, at least we will make sure your sugars are under control and you do not jump into the complication stage. The tertiary prevention is this complications should not last for long. You should again maintain your blood sugars to prevent the comorbid complications. So normally when I write my prescription, I just do not jump into write the medications, because I prefer telling that diet and exercise plays a very important role. Then only my medicine. So I need support from the patient side. So medical nutrition therapy, I will just highlight on what nutrition you have to take, what is good and what is bad, and customizing a fitness plan. So everybody, I cannot tell go to the gym or any. So whatever suits your body. So you can start slowly with a physiotherapy exercise, or you can start yoga. So what suits your body and which you feel like doing is more important. Or just a brisk walking day of to start off with 20 minutes. Also, it's a good fitness plan to start. And then building up your fitness level depends on your determination and how your body also accepts it. Next is most important is empowerment and motivation. So it's not only that, okay, I'm diabetic, patients should not keep telling like that. They should be able to face the situation and have a knowledge about diabetes and what are the other complications and how can I prevent, and have little of discipline in their life and follow little protocols. I think they should be able to handle it. Then only comes my medications, and then a regular follow-up with a diabetologist and the regular monitoring of blood sugars at home. So let's look into it one by one. So how are we going to maintain the balance? So BMI, glycemic index, calorie count. So all these things are very common words you might have heard. So I'm not going to talk about or complicate the issue and confuse you people. Just basic things we look into it. What I am doing and I preach is what I learned from my grandparents and my parents. So I will be talking about it. These are all high-five words. which I don't believe in also. So we cannot be calculating, okay, I have to eat 200 grams of dal. I cannot be weighing and eating it. Highly impractical for me in my busy schedule. So I'll be talking in very, very simple terms. So this is actually from registered dietitian advice. So we have a 3 meal pattern. So we have breakfast, lunch, and dinner. So what I want to add is I have a 2 healthy meal snacks, that is between the 11 o'clock and 4 o'clock. So between your breakfast and lunch, you need to have something. So it's all, you can also call it as a intermittent diet also. It's not intermittent fasting, it's called intermittent. We eat every 2 hours so that we do not overeat in the next meal. That is from when you have your breakfast and you jump towards your 1 o'clock lunch, you overeat. So in middle, you can have sprouts, you can have buttermilk at 11 o'clock so that your appetite is less and you do not overeat at 1 o'clock during your lunchtime. The same thing when you're going to have your dinner by 7, your fasting time is more. So at around 4 o'clock, you can have a little bit of tea. I saw many of you people sipping tea. So that's the right time that you should have so that you do not overeat during dinner also. So it should be easy to follow. Whatever diet it should be easy to follow and staple diet. So whatever it is, when we are in Chennai, we are rice eaters. So we can enjoy rice as well as the North Indians. They more of into chapatis. So both rice and chapati have same glycemic index, that is same sugar content only. Only thing is that the portion size. In my house, my katori size might be small. In the other person's house, the cup size will be more, where they take rice. So this is called the portion size normally we say. How much you take, see, the more you take vegetables, that is better. So rice should be little less. And your other food substances should be reduced to very, very minimal. So everything should be in your diet. I'm not telling that you should follow any paleo diet or keto diet. So I'm totally against it. In fact, we did a study where patients who are on paleo and keto diet, they had very good control of sugars. They lost weight. But what happened, unfortunately, was they were not able to sustain it. So then we fail in the whole diet itself. That's why I normally say paleo diet and keto diet, if they are very, very successful, they would definitely got a Nobel Prize for the person who had found this. But do not go into take carbs, proteins, everything should be in your diet. That's very, very important. So, and most important is meal at the right time. So I know everybody will be having meetings and busy schedule, but whatever it is, taking health as a first priority is more important than any other meeting or anything. And of course, we have special care during pregnancy. And so it's not like pregnancy means you eat for 2 persons, not like that. We normally have a diet chart for them. So it's again not like if it's like what they normally eat, a little bit modify and give them. So this is my favorite quote. To eat is a necessity, but to eat intelligently is an art. So it's actually I like this very much, as I wanted to share with you all. So a little bit about breaking the myths. So you need to follow a diabetic diet. So I would like to say that. So this picture says that don't worry, I am on diet book. So this is again is a fad thing. There is no diabetic diet. Heart healthy eating style that helps to maintain a healthy weight is normally recommended. Again, people keep asking me, eating too much sugar causes diabetes. So diabetes is basically not because of eating too much of sugar. The exact cause is basically I mentioned about the genetic as well as the lifestyle factors. So these are the things which land up having obesity and lack of physical activity, and this plays a very major role in landing up having diabetes, not only eating sugar. So, doctor, can I just have a fruit or eat be on fruit alone? So, we are not any sage or any sadhu to be only on fruit. We can enjoy our diet. Okay, so fruit again should be taken in moderation only. And whatever staple food we have. So, some people will be telling, okay, blueberries are very good in antioxidants. So, we need not export them from whatever we have. Even guava also are highly good in antioxidants. So whatever food we have, a staple diet that we follow in Chennai or we are in Mumbai or Bangalore, whatever fruits we get, that fruit is very important. So fruit is a healthy food which contains fiber, vitamins, minerals, and also carbohydrate and fructose. So people with diabetes need to discuss to the dietitian prior to adding up in their meal. So I do not restrict any patients that we should not take fruits and all. I add fruits to them because from then where else they can be getting vitamins and minerals. We cannot be adding up a lot of multivitamins to them. So taking fruits in moderate amount is very good. And the staple fruit that is available. So whatever seasonal fruit is available, like during mango season, you should take, but you should have your consciousness. Like you should not be taking a full mango. You should have a slice of mango. Enjoy that fruit. That's what I meant to say. And a lot of people keep telling, can I take sugar free? So this actually causes more harm only. There's something called plant sugar free, that's stevia. To some extent, it's okay, but I would again prefer not to use that also. So diabetic food products have no health benefits. These special diabetic foods can still raise the sugar levels, and they are often expensive also. So you can have a laxative effect because sugar free they add laxatols, which causes them landing up having diarrhea also. So better to avoid sugar free. So this is just for fun. I'm on a low carb diet. Whenever I feel low, I eat carbs. So this is just for a fun thing. I just put it. And skipping meals, like very commonly youngsters who want to lose weight, like can I miss my breakfast? See, breakfast is the most important thing which manages your blood sugar levels. So if you skip that, that's what they normally say. Elders say you should have a breakfast of like a king. Just having cereals or just having an omelette, that's not going to help. You should have eat a proper diet which has all the things, carbohydrates, your protein, everything should be there. So do not uh, skip any of your meals. Portion size is again very important and you have to look into it. And this also people ask us about, can I stop having milk to reduce weight? Dairy products are very, very important for the bone health, especially for women. So because of age, what they happen, they are unable to digest the dairy products. So I normally tell them take a low skim milk or add water to the milk, whatever they take. So calcium is most important during the especially menopause stage. They have to take. It can be the buttermilk, or they can take curds, or they can take milk. It's not like you have to go in for oat milk or skimmed milk like that. So whatever milk is available, to take it in small proportion, and or you can add water to dilute the saturated fat in it. And also one more thing is the dairy products have vitamin D. So that calcium and vitamin D is very, very essential for the bone health. So now we'll talk about a little bit of fitness. There are two arms in it. One is exercise and physical activity. So physical activity, as I said, is using the staircase or walking down to the nearby market. Exercise is one more pattern where you have to mobilize your body to have a very flexible life throughout your, have a flexible body throughout. So what I wanted to term was this only, using a staircase instead of a lift, cycling or walking down near to your market. And indoor games, like I was having a real tough time with my kids during this pandemic. They were too much addicted to the gadgets. So you should drag them to the terrace at least to go and have a walk at least for them. So again, they were too much into watching TV. I agree, it's difficult, but still we have to, as a parent and as a doctor, I feel like you should take responsibility at a young age itself. So regular physical activities not only lowers the blood glucose, it also controls weight and also your blood pressure also. So physical activity, we have to do it for the life. It's not only for 1 or 2 days. So you can be active. Pick some activity. It can be gardening or it can be a brisk walk. So whatever you like, you just pick it up and just keep moving. And whichever suits you. As I said, some people will like to do yoga. See, I cannot skip my yoga in the morning. So every day I get up 4:30 because I feel that gives me energy. So whichever suits you, you can go ahead with that. So physical activity is fourth leading risk factor for global death. That's one of the most alarming thing for us. So once we are physically active, we become physically fit, and then we can just keep all these disorders at bay. So by doing physical activity, you can reduce hypertension, heart attacks, stress-related problems, weight control, and joint problems, cancer. All these things can be reduced. So as I said, the three words that I wanted to use, physical activity is individualized. You can take up anything. It can be yoga, or it can be some mild physiotherapy exercises for flexibility or stretching exercises. If you're more into muscle strengthening, you can start off with small weight. Do not just carry out with 5 kgs or 10 kgs weight. Or you can do aerobic exercises like swimming, cycling, whichever suits you. But you start. That is what I'm saying. And it should be practical. I cannot tell a senior person to come on, let's go to the gym and work out for 2 hours. That's not going to be practical. So start little slowly, which will suit you. And sustainability. This should be throughout. It's not be like you, after listening to my talk, you people do it for 1 or 2 days and then stop it. So that's what I meant to say, that individualization, practicality, and sustainability is very important. So I wanted to share this slide. I just put it in a bigger screen. So there was one study which was done. Actually, we had screened around more than 1 lakh patients who we did randomized controlled trial. And then found out that only patients who are pre-diabetic, we just gave them lifestyle modification. We just looked into their diet pattern and exercise. So we were able to reduce 58% of the risk reduction was done. And we in fact reverted them back. And somewhere arms where we had given them metformin because they were very obese, we had to give them metformin. And some were on placebo, some are actually on a diabetic medication. So I like this part. Like most of the things can be prevented by plainly only following good lifestyle modification. So next is empowerment. So if you are a diabetic or a hypertensive, you need to know a little bit about and have awareness of it. So you should know how to manage. Of course, doctors are there, but you need to know how to manage it. You should accept, okay, I'm a diabetic, I should face everything and take ownership of it. Of course, the family support will be there, but again, you should be able to know what medicine. So normally when I write the prescription, I ask the patient, do you remember the name of the medicine? They tell, no, madam, pink color tablet, yellow color tablet. So I ask them, so what is your name? So they'll be like, okay, they tell their name, Geeta. Okay, why are you remembering your name alone? You should remember your medicines also. Everything is a learning process. So they make sure that at least they remember the medicine's name and they come to me. So it takes 5 to 10 minutes we need to spend with the patient, but I feel it's worth it. So maintaining the balance involves diet and exercise as well as, and then only comes the medication. So normally when we say it's empowerment means, so they should know how to take care of their food. Like as I said, they have to regularly monitor their food to see any neuropathy symptoms are there, any callus formation. So footwear is not only for diabetic patients. So everybody can wear footwear at home to prevent any neuropathy symptoms. And if you are sick, so you definitely we have there to help you out, but you should know how to manage it. How should you reduce your medications if you're sick? So all these things we actually have as a empowerment classes, education classes for the patients. And of course, it's not just right a patient who requires insulin. I just do not write the units and send them. I ask them to take it in front of me, 1 or 2 units. So that gives them the confidence. Okay, this is a very small device. So nowadays we have pen type also. So how to utilize it? It's very beneficial for especially elderly people. They can just dial it and see. So how to use insulin, and if they land up having hypoglycemia. See, hypoglycemia, one of the side effects of not side effect. It's like in case your sugars are coming down, it tells that insulin secretion is very good in the body. We need to reduce the insulin. So what are you going to do when you land up having low sugars? So we normally say if your sugars are going less than 80, what should be done? If do not just take a lot of chocolates. We give them hypo tabs like glucose tablets to just start chewing on it. So all these things are very important at the point of doctors. It's not like only you come to a doctor, take the prescription and go, but it's very important and responsible doctor. I feel I am quite responsible. I will definitely handle all these things before my patient leave my cabin. So we have talked about the keep of diet, exercise, and maintaining healthy weight. Education is very important, and lifestyle management. So definitely you are type 1, you need to be on insulin, and if you're type 2, then medications are very important. So discuss with the doctor. And the most important is go for a health checkup. Not like we want to make money, we are asking you to come for a health checkup. It's up to you, and it's very important, I feel, because if everything is normal, very good, you're also happy, I'm also happy. But if you find any small changes, it's the right time to treat and prevent any complications. That's why we ask for a health checkup. So next most important thing is everybody keeps asking me about to talk about is managing the stress. So I also don't know how to manage stress. There are too much stress at home as well as in hospital. So only thing is that we have to keep our mind and body correlated. So who are yoga experts here, I think you'll be able to coordinate what I mean to say. If you're not a yoga expert also, what I want to say is what your mind, your heart, your body, everything should be coordinated. So what is health? Health is a dynamic integration of body, mind, heart, and soul. So why it is important to be healthy? Health management is easy and enjoyable, but disease management is very costly and painful. So this is what is our lifestyle nowadays, but it's all there in our hands to change it. So stress is not the situation, but it's a response of an individual to the situation. So everybody has got stress in our life. Everybody has got only 24 hours. So please start working out on your exercise patterns and your diet, because stress has its own connectivity. It has a lot of studies have proven to show stress and hypertension, heart diseases, stroke, and diabetes. So take up anything. It can be yoga, be assertive, be positive. So if you are planning to quit smoking, so let it be today itself, start today itself. It can be any breathing exercise. So please turn off your gadgets whenever you are with your family. Enjoy a good sleep and have a good present music you can hear. So little bit on healthy kids. So if you see nearby when you're in park or wherever you walk, if a child is little obese, please do not hesitate. Uh, eh, just talk to the child and find out and tell them. You cannot go and tell them that you're very obese, you should start doing exercise. That the child will not understand. At least tell them that you should have a very good life ahead. You should be concentrating on your diet and exercise. That will be very healthy for the child also to understand. And women's health, very important, is the bone. Sorry. Next is the bone health and hormonal issues and PCOS. So if women is, we want always to be like this at any age. But what happens, unfortunately, is that our spine gets deformed as our age progresses. So a healthy bone is very important. Hormonal changes if you have during menopause, please consult your doctor. That's very important. And GDM and breastfeeding I have already covered. So that is common part of the women thing. And smoking cessation, if you think of quitting smoking, then start it today for people who are having smoking habits. So each time you smoke a cigarette, you are taking away 5 to 20 minutes of your life. That's what I wanted to say at this point. So again, cancer prevention is to stop all those. If you have a very good lifestyle practice, then we can definitely not even think about the name cancer. You can just delete it from the dictionary itself. You will not be landing up in a situation at all. So you can make a lifestyle as part of your life by recognizing the health risk factors, annual medical health checkup, self-analysis. Like I said, that IDR is scoring, you can do that. And reducing the health risk factors by awareness programs like this and lifestyle modifications. So annual screening is always necessary. Never ignore any symptom. Choose a very healthy lifestyle. Take medications if it's advised, and 80% of lifestyle disorders can be prevented. So take charge of your health and be healthy always. So it's never too late or too early to work towards being healthiest you. So believe in yourself, and thank you for your patient listening.
That's a very good presentation, Doctor.
Thank you, sir.
And let me go through the chat for any questions. I'm seeing Raman, Mr. Raman from Chennai,
Yes, sir.
has put up a question. I understand that the numbers relating to sugar count and such vital stats are all average figures. So a small margin is quite normal. Also, the standards vary from region to region. If so, is it not better to have a range rather than precise numbers? That is his question.
Yes, absolutely. Like I had actually given the range only. I didn't say specifically 100. I said 100 to 125. The range was actually given. So there are two schools of medical schools which follows. One is the IDF, that is the Indian Diabetic Federation. And then we have the American Diabetic Federation. These two schools always have fights, sir. So they want to prove that their value. See, according to Indian thing is, we have this range of 100 to 125, which the ADA also agreed. So what I wanted to say is the range, what we see is 100 to 125. People, when they see 126, they're not able to accept. They're like, only one number more. Why are you terming me diabetic, doctor? So this, once you leave this at this point, once you come next year, so your 126 is going to be 146. So you already blown full diabetic. So that's why we give this range to give an awareness only. So you're in this stage, you can actually take precaution to come back to the normal.
What I am seeing, no questions I see in the chat. A lot of appreciation for your presentation. because I also want to say that all your slides are very well prepared, and your explanation to them is also very good. So that is why everybody is clearly understood what
Okay,
you are
thank you so
trying
much.
to
That means a
tell,
lot.
that
Yeah.
I can make out that. There is one question that has come up.
Yes, please.
Mr. Kubendra Babu is asking, Madam, whether acidic stomach problem related to high sugar level.
Yes, as I mentioned that diabetes affects not only the eye, heart, kidney. It also starts with called something called gastric neuropathy or gastropathy, we say. So in medical terms, when we say gastropathy, there is reflex disease. So once your age is progressing, you will be having some indigestion problem. Apart from that, diabetic itself, the nerve supplying the stomach gets affected. So neuropathy, that is neuropathy. So once the nerve supplying stomach starts getting affected, you start up having acidity. Basically, it's not called acidity, it's called indigestion. They feel bloating sensation of the abdomen. So once that starts, there's a reflex. So whatever food content which has to go down, it comes up, and then you have start having cough as well as burning sensation in the throat and the chest. So that's one main thing. People get confused between acidity and chest pain. So they feel some chest pain is there and they come. But what unfortunately happened, I would like to share 2 weeks back was there was a young chap, 23 years, came to the emergency. So the duty doctor just called me at around 1:30 in the night and told there's a person who had come with acidity. So I told, okay, give Pantacid. That is the antacid we normally give. And then after 1 hour, again he complained of chest pain. And so I just thought, okay, just do an ECG and see. She was like little reluctant, the duty doctor. She was like, why should we do an ECG for a 23-year-old? Just told, just do it. If it's normal, good. But what we saw was he was having a very sharp ST elevation. That is heart attack he was having. So we immediately rushed into the cath lab, and then we had 2 stents for him. So see, it's like we can never say age is just a number we normally say. It can happen to anybody. So you should never neglect even the acidity, mildest or mildest acidity. Another side we have already always seen is like acidity can also land up patients having gallbladder stones. So do not neglect. Okay, don't keep popping up acid tablets. Like do not self-medicate. I would like to say, or just do not go to the nearby pharmacy and tell, okay, I'm having acidity problem. So that tablets itself will cause a lot of side effects. So you need to consult the doctor and then take the right medication. That's what I wanted to say.
That's very well said, Doctor. Self-medication is always a dangerous one.
Very true.
Yeah. Next question I'm seeing from Pune, Indra Pasricha is asking, how to count yourself to know your sugar level?
Yeah, nowadays we have the small glucometer we have. You can just prick your finger and just take it at home. If you're a diabetic, you can do that at home. But if you are eager to know like what is my diabetic status or whether I'm going to be diabetic, you can just check and see. So what I wanted to say is this part is this glucometer we normally use for patients who are already diabetic to see the range. Because what we are going to do is prick this part, that is a capillary blood. Normally, we take blood from our vein. So this is venous blood. Definitely, there will be difference between the venous blood and the capillary blood. But we will know at least the difference. Like when you're going for a blood test to the lab, I always tell my patients, take glucometer also with you. When you're doing your blood test in your venous, check it in the capillary also. So you will know what is the difference. How is your glucometer working? So that will give you a range and tell what range you are in if you're a diabetic.
Okay, that's a good suggestion. So people can follow this method. Others are all giving, appreciation only. What I wanted to ask you, I have one. In one of the initial slides, you
Yes.
have shown about type 1 and type 2 difference.
Yes.
In that, there's something like a door which is there, which is closed.
Yes.
And can you explain it again? Because it was not that very clear to me.
Okay.
If you want, you can show that slide.
Yeah, sure.
You're not started sharing your screen.
Yeah, 1 minute, sir.
Okay.
I'm just sticking to the slide so that I can just.
I think it was initial number 5 or something.
Okay. Yeah. You able to see the slide, sir?
Yes, this is the one I was referring.
Yeah. So this, what I wanted to say is, a person without diabetes will have a very good insulin secretion. See this smiling insulin is quite happy because he is able to moderate the insulin from the blood vessel. So this red color box is the blood vessel, and this is the cell. This is the cell means going the glucose, whatever food we eat, the glucose has to go to the muscles for us to work out. So if it remains in the blood, then it's going to affect the heart, kidney, everything. So that's what he is happy man here. But here we are missing that happy man. There's no insulin only. So the blood sugars remain in the blood, landing up having high blood sugars. They'll end up even having diabetic ketoacidosis. That is diabetic coma. Also they'll end up when they come very high sugars like 400, 500. We are see very young children. So my youngest child is type 1 is 3 months old child who's recently on pump. I have put her on a small pump. So it's like very difficult for the mother to just keep pricking the child with the insulin. So we put on one pump. So it's just like a small pager stuck to her back. So every 2 hours, insulin keeps going to the child. So, and later I have one more child who's on type 1 diabetic. Now he is in Bahrain and he's a basketball player. And he tells me, doctor, don't tell me I should not eat ice cream. He knows how to manage. He will eat ice cream when he goes for parties and he increases the insulin. So that's how a child handles diabetes. So once they are in that status, that's why I never said do not stop your or restrict yourself from your diet. You should know what to eat. How to eat is very important. So that's what he has got very good control. And of course, we have Wazim Akram, who's a type 1, so he's a cricket player. He is our boss, Dr. Mohan's patient. He keeps coming every year. So yeah, so it's nothing like you should not have diabetes. If you're having diabetes, your life is spent. And what I wanted to say here was type 2 diabetes. We have insulin, but he's very sad because he's not able to secrete much insulin. So we need to give tablets to increase the insulin secretion in the body, and then we go back to this state. So this is actually from Jocelyn. It's, Jocelyn Diabetes Center is in Boston. It's a 100 years old diabetes center. So I'm very happy to say that I was part of the teaching program there. It was actually for 3 months in Boston. Here I see in a day around 70 to 80 patients. So the first patient, what I see in the first day, to the 70th patient, I try to give my maximum, but unfortunately I'm little lagging there. But over there in Boston, they have only 8 to 10 patients appointments per day. So then you can imagine how much of care and how much of education materials they share and all. So according to our Indian setup, it's very, very difficult, but I am trying my best to share my knowledge and to make patient understand. So there are government, when I see the prescription, it's like they have seals. I'm not against the government hospitals. They don't have time to handle that much of load. They have seal, like if they just put a seal, it's like all the medications come and continue. So they don't have time to the patient to discuss what is their problem. Are they recovering? Are they again progressing worse? So I feel little sad in that part. So apart from the awareness program, I make sure my energy level is the same for the first patient I see in the morning till the last patient I see.
That's very good. Nice explanation. I got my doubt cleared. And I was surprised when you said that this type 1 and type 2 has been discovered long back in our
Yes.
ancient India. I was thinking type 1, type 2 is all modern discoveries. That is news to me.
Yeah, our Indian scientists are very talented and highly professional that time itself. So they used to, what they did was they used to collect when patients are losing weight. So they collected the urine samples and they kept it. So what they found was they started seeing ants coming towards the urine sample. So that's when they came to know that there was some sugar. They kept sugar also. So as ants gets attracted towards sugar. So then they came to note that urine contains sugar, and then they process with a lot of scientific work that time itself. So really, we should give hats off to them really for the dedication. We are not nothing less, sir, compared to the Americans or the Australians.
We are much
also
more advanced in that case.
in fact, we are only, you see a lot of doctors, all my friends who are there in US, they give a lot of talks, and we feel very proud that being an Indian, we are going there and we are spreading awareness and taking care of their patients. So we are nothing less, sir.
Yeah. Another question is next is Yamuna Subramanian is asking about the POCD. Because a
POC.
lot of women complain about this and lifestyle pattern for young women. She
Yeah.
wants to know.
So POC, it's called polycystic ovarian disorder. I don't call it disease because it's a disorder because of the hormones changes that happens. So if you tell disease, they get very scared. Like they feel that they'll end up having AIDS itself. So AIDS itself is curable. So it's not that only obese people end up having PCOD. I have a lot of young patients who are thin, very lean. They have PCOD. It's basically hormonal. So what happens is that the ovaries, there are a lot of cysts accumulate. So once they start losing weight, it automatically the cyst starts reducing. But sometimes if the diet or exercise is not sufficient enough, we give them tablets like metformin to break the cyst. In spite of that, they are not able to get regular periods or conceive. Then what we do is we normally we go for a laparoscopic surgery and burst the cyst with the laparoscopic instrument. So these are all the three divisions of PCOD. And I actually deal with a lot of gestational diabetes and IVF patients. That is, IVF is test tube babies, like we normally do in vitro fertilization. That's a very, very challenging case compared to normal type 2 diabetes patients. We can actually give them tablets and treat them, but every patient in gestational diabetes is different because each one act very differently. Some patients fasting will be very good. Some patients postprandial will be very bad. So proper insulin, proper administration of medicine is very important. So PCOD, if you ask me, I can talk for one more day, but I just want to tell these three important things. So yeah, there's a treatment for it and we can control them from landing up having any diabetic problems later.
Good. I hope Yamuna got her answer. Next is Indra Pasricha from Pune is asking, what is 3 months sugar test for diabetes?
Yeah, we actually do HbA1c, that is glycated hemoglobin, we normally do it. That gives 3 months average. So it's like patients say that, Netida madam, pongal sapta, annala in sugar high. So they come to tell like, kali humne kuch jalebi kaya humne, isliye zyada hai sugar. हमने ज्यादा थोड़ा चावल खाए. It's not that. You have to prove it to them that it's not because of yesterday. It's the sugar control is not good for the 3 months. इसलिए हम HbA1c करते हैं. And we actually can do a serum fructosamine also. It's one more test, which we can say for 2 weeks. For 2 weeks also, there's an average of blood sugar. But serum fructosamine normally we don't do because it's an expensive test. But 3 months average is very good thing to prove the patient that you're a diabetic or not.
Yeah, doctor, I suggest you can stop sharing the screen so that
sure.
everybody can see you and
Definitely.
have your answer. Okay, next is, the name is not there, only email ID is there. Sharada. Probably name is Sharada. What is the question? Here it is. One question, frequently passing urine is one cause for diabetes. Or yes or no? Please answer.
Yeah.
Okay.
See, there are two things. That's what I told. The symptoms what I had mentioned was it's not like these symptoms are there, they're going to land up having diabetes. So passing too much of urine, it can be seen in urinary tract infections. So normally we do a urine test and then see whether there is either there is pus cells in the urine, which is causing them frequent urination, or there is sugar in the urine, which is because of diabetes. Secondly, pregnant ladies, they pass a lot of urine. So we should not be like all pregnant ladies because the uterus is compressing on the bladder. So it's not like that. So we need to do a urine check and to find out what is the main cause.
Right. I think I don't see any more questions except appreciation for your presentation. So many people have put.
Sir, sorry for the interruption. Rajappan sir has requested 1 minute, sir. He want to say something.
Yes, yes, Mr. Rajappan, please.
Mute me. Okay. Good evening, madam.
Yeah, good evening, sir.
Rajappan. You are so clearly, you have told all the factors to be taken care of and also not to be worried so much.
Yeah,
One
definitely.
thing I want to know, the lifestyle. Your topic is lifestyle disorders.
Yes.
The type of life what we are living in India, especially the IT people, they are not living the natural way of living in India.
Correct.
6 to 6, night 10 to 4, at least minimum, correctly you have to sleep. But the way in which they are leading, for example, in America, they are dealing up to 12 o'clock, they are working on the cell or the laptop. Then 1 o'clock, again they get a phone call at 1:30. They don't live in the normal life. You mean to say only diabetes will be the result? There are so many other things will come, isn't it?
Yes, yes. I'm not telling you, I didn't mention only diabetes or the cause.
No, you were.
Stress was the first thing which I mentioned. So because of lack of good sleep, your circadian rhythm, that is your rhythm in your body changes. So stress first, your mind gets affected.
Yeah.
Once you are stressed up, you sit continuously on the laptop. You do not do any physical or any flexibility exercise also. So what lands up is you just go, you have your food, again you come and sit. So that's slowly going to land up you having obesity. Then you're going to land up having diabetes.
The lifestyle has changed.
It's a change.
Yeah.
That's why everybody says you're a diabetologist. Why don't you talk about diabetes alone? I told no, it's not only diabetes. There is a full cluster. What we are seeing only is a tip. That's why I put that iceberg also.
Thank you.
So,
Thank you.
that's what.
So that's very good. Looks like no more of a question. Is there somebody who cannot put this question in the chat box but want to ask? They can raise their hand.
Dr. Reena,
Yes, madam.
because my audio was not working, so I had to put it thing in the chat. I asked a question about POCD on behalf of my daughter,
Right,
and
right.
I know how much she's suffering. And then when
True,
she
true.
comes from Bombay, I will definitely like to bring her to your clinic or something like that.
Definitely, definitely.
And I got a, what shall I say, enormous now consolation that there is something where she can be referred.
Definitely, definitely.
Thank you very much. Your explanations were very, very clear, crystal clear.
Thank you. And thank you, Kasi sir, to stop me at the right point to say that I'm fast. Normally, I have the very habit of speaking very fast. So because
Yes.
because of the load of the patient, but I like to change myself, and I like people who comment on it because I take comments in the right way. So yeah, I definitely will make sure that I speak little slowly next time.
Raghu sir wants to ask some question.
Yes, sir.
He can.
Doctor, really, first I want to thank you. You have given such a detailed one for seniors like us. We can so easily understand. But there are one or two things. Of course, you said already you are in jet speed and all.
Yeah.
See, that is the speed which we have to follow up is difficult because most of the slides, the words and all are medical terms. So it is very difficult when you say from this stage to the stage to go, because we require what is there and all. But all said and done, your slides alone speaks like a documentary. I don't say movie. Movie means we like the story and all. It is a documentary because this is an area where we have to absorb. So it is just like a documentary. We can do it very well. Only thing is, this diabetics, as you said, most of the people have got. One consolation if I get diabetic is next another 4 or 5 people are also diabetic. I am very happy because other people are there. I am happy. But
So you want your friend circle also to join you?
not that friends, because it is spread like that. It is there, which the community. But thing is, we are taking all steps, yoga, this and that and all, some eating that. But as you said, one is not preventable. That is only 10% and all. Other things, we are only bringing it our own stress and all. This rightly said, we have to be very careful and all, because that consolation is leaving alone. The diabetic has become a very, very common thing. Whether I have got another disease or this disease, that disease, always they say you are diabetic. that comes into this. Now I am 6.5, as you said, average. But my doctor said you can go up to 7 also, because now they say that
Yeah.
parameter
Again,
is
age,
changed.
see, if you are
Change.
in your 40s, definitely we will not have we'll plan for a very tight control of diabetes. Once you are 60 plus like that, we do not want your sugars to drop down. See, again, the target of blood sugars is different for different ages. Because at the age of 60, 70, we do not want fasting less than 100. So that is low sugar for them. So again, depending on the seniority, we treat according to that. So as your daughter said, till 7 is very good. Even
Yeah.
7.1, you should not go, sir. That's what I want to say.
So as you said rightly, instead of ourselves jumping into say, I got 6.5 and getting a panic and all, go to the doctor. Doctor says, no, don't worry. It is another 7. You are up, I am 80. You are 80, nothing to worry. You can go up to 7. Not that because he said I will go up to 7, but I am now controlling myself. These are the things. But diabetic is a very, very common, because you have given such a vast this one. It is this. I am going to do your slides itself as a small video clip I am used to send. With
Yeah,
your
actually,
permission.
there was one excellent video session. Short video was there, but I was not able to put it because there was a little technical issue. There's one excellent video I would like to share to you later. Like maybe personally, I will share. That video itself tells about everything what I spoke in 2 minutes.
You will be very happy. You
Yeah, I
kindly
will
share
send,
with them.
yeah, definitely.
That will be
And
very happy.
I put medical terms because some people are little more friendlier towards Google. So they will like to go and Google those words. That's why I put those medical terms also. And I showed even the cartoonic pictures to in a very clear way to understand also. So it's like,
No, I can fully understand. This itself, with all this, you have taken 1 hour to give. If you go explaining everything, it will
Very
go to
true.
2-3 hours, or you say you may require 1 day.
That's
Thank
what
you very
my-
much, doctor.
thank
Thank
you
you.
so
Thanks
much.
a lot.
Thank you.
Thank you.
That's a very
Madam,
good.
Madam, I want to ask you, doctor, like people say you if you have blood pressure, definitely you are going to get diabetes. Is it true? Because they asked me what you have. I said I have got BP, but I don't have diabetes. You are going to get it because it's connected. They say, is it true?
Yeah, like as sir has told, like he wants his friends also to get. So hypertension's friend is diabetes. So definitely it will just capture it. So I will not. I hope and I pray you don't land up having diabetes. But on a safer side, you should definitely check your sugars. It's not that all hypertension patients land up having diabetes. Basically, hypertension is the blood pressure that is happening in the body. And if your diet is very good, then you're not going to bring its friend called diabetes. So everything is there in our hands only, madam.
Okay,
So,
thank you, madam. You told in a very simple way, very down to earth doctor, I can tell you. Talked in a very nice way to keep healthy in a lifestyle is
true,
very
true, true.
important.
Thank you so much. Thank you so much.
Thank you.
And also the humor which you have included in your presentation made it lively. I like that low carb joke.
Yes, sir. That's what I because every time talking about medical terms, no. So a little bit no to wake up people who are not interested or who are little. They feel if my talk is little boring. So I read a lot of books. So whenever I see this, I just take clip shot. So I felt it's very important also.
You please share that 2-minute video.
Yeah. I hope I can play it now. I will just see whether I can play it.
If you are able to do it, you can do it now
Yeah,
itself.
sure.
I think we can afford to have some more time. Somebody has commented, Premlata Narendra. Since you covered a vast portion in a limited time, it was slightly fast. Yes,
Yeah.
correct.
I agree. I very
But
much
we
agree.
need more time, which is not available with our restricted. So from the comments, I can see so many people have appreciated your presentation. Screen sharing a video is always a bit tricky.
Very difficult things, and I'm not very techie savvy.
Okay.
So
If it
no
is
problem,
not
sir. I will share it some
share
other
it,
time.
then we
Yeah.
can see
Sure,
it.
sure, sure.
This thing. I don't think any more question. I'm not seeing anybody raising a hand. And Sharda Mani is the one who asked that question, which is only now she said that yes, her question is answered. Because instead of name, it was a email ID that was there on her
Yeah.
ID. Okay. Since no more questions, I feel that we can wind up with my heartfelt congratulations and thanks, Doctor, for this very detailed presentation with a lot of slides which are self-explanatory, and also the humor which you have used to convey the message is very much appreciated. On behalf of Chennai chapter, I thank you very much, Doctor, for having time for this. Very good one. Thank you so much.
Thank you. Thank you so much for your patient listening, and take care. Be safe.
Right.
Thank you so much, Chennai.
So,
Thank you,
This is
doctor.
such a lovely
you.
program.
Thank you, doctor.
Thank you, doctor.
Thank you.
Thank you.
very nice. I will have to change it to gallery
Thank you,
so
Kachi.
that I
Thank
can
you, Kachi, for
see all the
organizing.
people.
Thank you.
I hope everybody is able to see, or they are seeing me only. I don't know.
No, everybody's seen.
Everybody sing.
Okay, very
Gallery,
good. So that has
Gallery.
been done.
Especially Kashi Vishwanathan. Always I'm remembering your face. Shardaman.
Thank you, Sharda Mani.
Always I am meeting you in the online. No.
Okay.
Yeah. Kasi attends every program. Most
I
of
don't miss any program
Lakshmi,
because
you are also.
Yeah, I like to attend and know everything, whatever I can.
Right. What about the host? Where is the host? I want to tell. Is she there? Merita?
Sir,
Yeah. I think we have exceeded our time. Is it only up to 6 o'clock? I think.
yes, sir. Yes, sir. It's up to 6 o'clock.
Anyway, everybody is expressing their happiness, and very good program today. So we'll be able to close now, I think.
Yes, sir. We can close.
Bye, everybody. Thank you for your time.
Bye.